I'll begin by verifying the healthcare provider's orders. Then I will verify the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I will then check the medication order in EHR, then check the medication against the order. I will be administering timolol. The solution is 0.25%, and the order is 1 drop in each eye twice per day. Upon entering the room, I will close the door to ensure patient privacy. Then I will place my supplies on a clean, dry, flat surface area, perform hand hygiene, and introduce myself to the patient. Hello, Mr. Smith. My name is Bessie. May I see your wristband? Thank you. Can you please tell me your first and last name and your date of birth? Thank you. Mr. Smith, do you have any allergies such as certain foods, medications, seasonal, or any others? No? All right. Well, Mr. Smith, the purpose for your visit is because your doctor has prescribed you to take this ophthalmic or eye medication. This medication is called timolol, and the order is 1 drop in each eye twice per day. This medication is for your glaucoma. Timolol is a beta blocker, which means it reduces the interocular pressure or pressure in your eye and helps alleviate glaucoma. Now, some common side effects are blurred vision, sensitivity to light, or a slight headache. And just so you know, when I administer the medication, you might feel a slight stinging or burning sensation. Also, adverse reactions to this medication require immediate attention, such as an irregular heartbeat, chest pains, difficulty breathing, wheezing, or shortness of breath. If you experience any of these symptoms, please report them immediately. Do you have any questions? All right. Mr. Smith, to administer this medication, I'm going to position you lying supine, that's flat down, raise the bed, and lower the side rails. Are you comfortable? All right. I'll now perform hand hygiene and apply clean gloves. Okay, Mr. Smith, please try not to blink or close your eyes when I administer this medication. This may cause the drop to land on the outer lid margins, and if that happens, I'll need to repeat the procedure, okay? Now, I'm going to start by cleaning your eyes of any drainage or crusting along your eyelid margins or inner canthus with a warm washcloth. If there isn't any dry crust, I will soak it by holding a warm damp washcloth over the eye for several minutes. When cleaning a patient's eye, I'll start by wiping from the inner canthus to the outer canthus, using a clean corner of the washcloth for each eye, and making sure to never rub against the eyelids. I have my warm washcloth. I'll gently press on the inner canthus, going towards the outer canthus, getting a clean corner of the washcloth. And the same with the other eye, starting from the inner canthus to the outer canthus. I'll now dispose of the washcloth in the proper receptacle. I'll now remove my gloves and perform hand hygiene after properly disposing these. Now I'll apply clean gloves. With my non-dominant hand, I'll take a clean tissue and hold it on my patient's cheekbone, just below the lower eyelid, gently pressing downward with my thumb against the bony orbit, making sure to never press directly on the eyeball, and exposing the conjunctival sac. Then I'll ask my patient to look up. With my dominant hand, I'll gently rest it on the patient's forehead, holding the filled medication eyedropper approximately 1 to 2 centimeters above the conjunctival sac. I will then administer the 1 drop prescribed eye drop into the conjunctival sac. I have administered the 1 drop medication. I'll remove this tissue, grab a clean tissue, and gently apply pressure to the nasolacrimal duct, avoiding direct pressure on the eyeball, holding this for 30 to 60 seconds to prevent any systemic effects, and asking my patient to gently blink. Once the 30 to 60 seconds are up, I'll remove this tissue and grab a clean tissue and repeat the steps for the other eye, holding this tissue on the cheekbone just below the lower eyelid, using my thumb to gently press downward on the bony orbit, exposing the conjunctival sac. Again, making sure not to press directly on the eyeball, asking my patient to look up with my dominant hand, gently resting it on the patient's forehead, holding the eyedropper approximately 1 to 2 centimeters above the conjunctival sac. Administer the 1 drop prescribed medication into the conjunctival sac. Once I have completed the medication eye drop, I'll remove this tissue and grab a clean tissue and apply gentle pressure on the nasolacrimal duct, again for 30 to 60 seconds to prevent any systemic effects, making sure to avoid direct pressure on the eyeball, and asking my patient to blink gently. Once the 30 seconds are up, I'll remove this tissue. Once I have fully completed administering the eye drops, I will lower the bed, raise the side rails, make sure my patient is in a comfortable position. I will then discard the tissues in the proper trash receptacle. I'll now remove my gloves. Dispose of these in the proper receptacle. Perform hand hygiene. And make sure to document the procedure. Upon leaving the room, I will take the medication, make sure the call light is within my patient's reach, and after leaving, I will document the procedure.